record. All right, and then give me one moment to go live on Facebook. Here I go. And colleagues of mine from National Educators United, can you please watch the live feed and make sure I am doing this or it pops up correctly.
All right, well, welcome everyone to National Educators United and PRESS NYC, our COVID Safety and Schools Sustainable Protections webinar. We are thrilled with our guest speakers and our moderators this evening, and we are thrilled that each of you have chosen to spend your time with us.
Almost there.
As we're entering the space, if you would go ahead and place in the chat your name, where you're from, and thank you for being here. We'd love to know that. We will have that on. Please be mindful and respectful. We're using that chat just to introduce yourselves and get a sense of who is with us this evening, where you're from, your name, your state. If you're an education professional or healthcare worker, we'd love to see that as well. So welcome once again. So in that chat box, share your name, your state, your role, your pronouns. And as we are now live on Facebook, we would love it if each of you would share the link, which we will give to you, and place it with your network so anybody who was unable to be with us this evening can see and hear the important information that we would like the world to hear. So once again, thank you for taking a moment for sharing this webinar with your own networks. For anyone who's here this evening who will be live tweeting, we would love it if you would use the following hashtags. We've got hashtag Unite for Safe Schools, hashtag Make Schools Safe, and hashtag Stop School Spread. And here's our brief agenda, really quick. We have our welcome and introductions. If you're just still arriving, place your name, your state, and what you do. We will have a panel discussion with our leading health experts, and there will be some time questions and answers at the end, towards the end, and some calls to action. Next slide. And now I'd love to introduce to you our fabulous moderators for this evening. First is Clarice Salas Ramirez. She is a distinguished medical lecturer and neuroscientist at the SUNY School of Medicine. She is the advisor for White Coats for Black Lives and supports students in addressing medical mistrust in the Harlem community. She is currently president of CEC4 and serves on the steering/advisory committee of Parents for Responsive, Equitable, Safe Schools, PRESS NYC, NYC Opt Out, Black Lives Matter at Schools NYC, and NYers for Racial Justice Public Schools. And with her is Selena Carrion. She is an experienced educator, former NYC DOE classroom teacher, library media specialist, writer, and activist working in NYC. Selena currently works as a curriculum writer and instructional designer. She also advises and consults on projects at teacher colleges, NYSED, New Schools, and PBS. Her writing has been published in NCTE, Chalkbeat, and ACSD, among other publications. Selena grounds her work in critical pedagogies, anti-racist teaching, and the equitable transformation of our schools. Welcome, welcome. And at this time, we're going to launch our first poll question, which you will see here shortly. And the question is, what are you concerned about right now? And you can select more than one option. So your choices are there. Rise in cases, students whose families have already been hit hardest by COVID, missing preparation for standardized testing, my own safety, my child's safety, the mitigations in my school. And all of your answers are coming in. Thank you for sharing. You can choose more than one. We'll give you a couple more seconds to get your choices in. And then we will see where everyone is most concerned. Right, I think we have all of the answers in. Should be able to
One
see.
moment. They're still
Yep.
coming in.
Oh, we'll give you another couple seconds.
All right. Looks like it's slowing down now.
Thank you. All right. And you can see that many of us here are very concerned about the rise in cases. Obviously, our families who've been hit hardest, many of our communities of color. And then the mitigations in schools, I think, is weighing heavily on many of our minds. Not only those who work in those buildings, but those of us who send our own children there as well. So thank you all for participating in the first poll. And at this time, I will hand it over to our moderators who will introduce you to our experts and facilitate this incredible conversation.
Awesome. Good evening, everybody. Thank you so much for that great introduction. And I'm super excited. I'm one of the steering committee members for PRESS NYC. And we've been trying to have this conversation with educators, parents, and leaders of schools for a long time. As a scientist, it's been really critical for me to also engage in these conversations with my colleagues. And so having these panelists with us tonight is definitely an honor. These are people that are on the ground daily, that are talking to school communities, that are doing the studies, that are helping us inform policies, and that are keeping our leaders, both locally and nationally, at task, which is what's most important, that we come together and really make sure that our schools can provide a quality education to all of our students with the right mitigation measures, with the appropriate instruction, and with the support that our families and our educators need. And so I was also super excited when Selena agreed to moderate this with me. She's been on the ground and has so much knowledge in terms of what's happening in our school. So I want her to also introduce herself before we start with our panelists.
Hi, everyone. Welcome. Thank you so much for having me. I'm so excited for this panel. We have experts from many different fields and areas of expertise that I think are really going to engage in a thoughtful, very needed discussion right now on COVID safety, our schools, and children. I'm a public school parent, former public school teacher, and this is not only important to me, just from a personal level, but also a professional level. And I'm just really excited to hear what everyone has to say today, and also hear what everyone in our audience is thinking, feeling, and experiencing right now.
Awesome. So, we're going to have our panelists talk to us about some of the important findings that they've collected these last 2 years. I can't believe it's been 2 years. Everything is so warped. We're going to start with Dr. Raisman, who has been on the ground. Y'all, if you're not following her on Twitter, you're missing out. She's going to talk to us and give us a brief introduction, but also talk about some of the things that we're seeing. We know that there's been a disproportionate impact on marginalized communities in terms of how COVID has really affected our lives. And she's really going to help us create the foundation and the framework in starting this conversation. So Dr. Raisman, take it away.
Thank you. I'll start by just going to the next slide. Good evening, everyone. I'm Julia Raisman. I'm an assistant professor at Boston University, and I run the COVID-19 U.S. State Policy Database. Next slide, please. I want to start off by thanking you for being here and saying thank you to everyone who's doing important work, teaching, parenting, and supporting children and communities growing up and staying well in a pandemic. This is incredibly challenging and what brings us all together today. Next slide, please. We are in a continuing pandemic that is affecting the health of children, parents, teachers, and staff. A record number of children and people of parent and teacher and staff age are hospitalized right now. Next slide, please. 167,000 children had lost their parents to COVID before this surge. We need better data on health of educators and all workers with high exposure to the virus, and we know educators are being affected. These two educators on the bottom right are from one district where 16 teachers and staff had died just by November. And we know that we are adding to this toll quickly after the Omicron surge. Please go to the next slide. There are also harms of the virus for those who survive through short and long-term illness. People who miss work due to COVID and themselves or caregiving often report food insufficiency. We also have concerns and more to learn about long COVID, including evidence that there's asthma and chronic headaches that are debilitating for people. We need to learn more about how often this happens, especially after people have repeated infections. Next slide, please. The virus is making teachers and students and staff sick, and it's causing some schools to close. Students and teachers are also striking for fear of becoming sick because they do not have masks and tests available to protect themselves. Next slide, please. Unfortunately, I think this is likely to continue. We've had 3 surges since the summer. We've seen that COVID did not end. Oh, sorry, these arrows became misaligned, but we had a surge in July, in November, and in December, and they caused 230,000 deaths from the first 2 Delta waves. And now we have yet to see the toll of the Omicron wave, but it could be just as bad. And we are likely to have more surges due to seasonality, due to new variants, or due to waning immunity. And we do best to prepare for those surges and to reduce their toll. Next slide, please. We do not want the virus to continue to manage us, our health, our lives, our schools, and our society. And it's the virus that is causing the harms. It is not unions, it is not teachers, it is not each other. It is not even the unvaccinated, who often are low income and underserved. It is the virus, and we have to come together to support each other in addressing it. We need leaders to lead in helping us come together with good policies to manage the virus so it does not manage us. This starts with grounding in facts that COVID spreads in all crowded indoor settings, including and especially schools, and that COVID is harmful for children and for everyone. It starts with acknowledging that vaccines are our most powerful tool to reduce severe disease, and by scaling up and making vaccines more equitable through vaccine mandates. We can scale up masks with data-driven mask policies that help everyone mask together most effectively when and where it's most important, indoors and in surges. And we can continue to provide free N95s and KN95s at the start of every surge, and to provide people with more than one. We can scale up and make equitable ventilation through school safety standards and workplace safety standards that apply to all public buildings. And we can make tests free and available to everyone. especially to people who have the most exposure, like everyone in a school setting does. Next slide, please. We see that there are large inequities in vaccine delivery that have been present since the summer. This graph depicts vaccination rates by income and the proportion of people who said that they would definitely not get a vaccine in dark orange, and the proportion of people who said that they would consider getting vaccinated in lighter orange. And you can see that there are more of the lowest income workers who report that they would be willing to consider a vaccine than say they would definitely not get vaccinated, who have not yet been vaccinated. So we have a lot of work to do to improve vaccine equity. We also see large racial and ethnic disparities in vaccinations among children in particular. And we have a lot of work to do to improve vaccine delivery through school-based delivery and neighborhood-based delivery. Next slide, please. Mask policies are also one of our most effective policies to reduce the spread of a virus that spreads through the air. It's as simple as hand washing in a pandemic that can spread through contact with our hands and bacteria on our hands. And what we can see is that masking alone is not as protective as masking together. If you mask alone, then you may face air filled with COVID. Next slide, please. If you mask together, then you reduce the amount of COVID in the air and you reduce your likelihood of inhaling it, protecting everyone. Next slide, please. We have strong evidence that face mask policies are one of our most effective policies for reducing the spread and all of the many harms of the virus. These are two policy analyses that compare the case growth of the virus before and after states implemented mask policies relative to over time in comparison states. And what we see in both studies is that reductions in case growth begin immediately and increase over time because each case averted prevents transmission to several other people. Next slide, please. We know that people may not want to wear masks perpetually, and we think then it's most important to focus on wearing masks when and where it's most important, indoors and in surges. And one of the most important things we could do now to address the next surge and prepare for it is to implement data-driven mask policies that will automatically turn on if case growth increases. These data-driven mask policies will not turn on if there is no other surge. So they really only turn on if we need them to protect us. And they're one of the most powerful tools we have for reducing the toll on health, lives, society, and the economy. During the Omicron surge, 23 of 27 European countries had mask mandates. The United States really stood alone in the sense of being a high income country that did not have widespread masking. Next slide, please. The good news is that most people want to come together to support each other and to keep themselves and one another healthy. 72% of Americans supported mask policies during surges, and 68% support vaccine requirements. So this should really give our leaders the support that they need to implement good COVID control policies that benefit all of us. This is not the normal that we want. We do not want record high hospitalizations to continue happening in unpredictable ways without the supplies to address it. And we can come together to do better for one another with good leadership. Thank you.
Okay, is it time for me to speak or is there a transition?
Yes, sir, Dr. Huffman.
Okay.
I do want to ask, though, if we can go back to the intro slide so we can talk a little bit about you. So Dr. Huffman is coming to us from the University of Denver. Dr. Raisman, I'm sorry, I didn't mention that she was at Boston University in the School of Public Health and doing lots of work on the ground, particularly around masking. But Dr. Huffman is going to talk to us about ventilation and why ventilation is important. He really makes the connection between our environment, how it impacts health, and what sorts of policies need to be in place in order for us to make sure that this airborne virus doesn't continue to affect our school community. So Dr. Huffman.
Great, thanks. Thank you, Dr. Raisman, for that great overview on COVID and how it affects kids and schools. So I don't have a lot of slides here. I prepared some thoughts. So this will come in a minute or two, but you can look at that to start off with. So first of all, I'm going to speak from the perspective of an aerosol scientist and an air quality scientist, but I think it's important that we're on the same page here. We all want kids and teachers to be healthy and for schools to be open whenever possible, but we want schools to follow wise plans and to make schools as safe as they can possibly be. I have 3 kids myself in the 5 to 11-year-old range in local schools, and frankly, I'm weary of the constant worry about whether the schools are safe enough for them. It seems like it's a weekly conversation of what we're going to do with them. Being prepared against the Omicron wave also means being ready for future waves of this virus and other threats. And best practices against COVID will also pay health dividends for generations. I also want to underscore the hard and excellent job that teachers, students, and schools are doing through this pandemic. But messages filtering down to districts from the national level have been really confusing, as I'm sure you feel. So I want to step back for just a couple moments and make sure we're on the same page. First of all, it's been long since crystal clear that COVID spreads primarily by inhaling small viral drops breathed out from an infected person of any age into shared air. Those viruses spread like smoke and build up indoors, even when you can't see them, and even if no one else in the room knows that they're contagious. You're at the highest risk when you're closest to someone, but you can breathe the virus in like smoke no matter where you are in the room. Washing hands and doing normal cleaning is good, but focus your efforts on and your budget on cleaning the air. So I want to talk about 4 key points in the minutes that I have here, but from the perspective of aerosol science, the airborne science. First of all, the COVID vaccine is safe and it's critically important for everyone. It's not a silver bullet, as you'll hear, but it's a key piece and it's critical to reducing the chances of serious illness. Get vaccinated if you can. Encourage students and teachers to get vaccinated or boosted by sending reminders and making it clear that you're an ardent supporter of vaccine importance. Second, I want to talk a little bit about masking. Wear a tight-fitting mask, not just an old cloth one from last year or a loose blue-fitting surgical mask, but a high-quality, well-fitting mask like an N95 or a KF94 rated mask. One study that I show here on the screen suggested that wearing surgical masks, 2 people wearing surgical masks in a room reduced the risk between those 2 people by 10 times. That's great. But wearing N95 masks reduced the risk by almost 1,000 times. And there's also absolutely no scientifically credible evidence that high quality mask wearing does any harm to kids or adults. Even today, the White House announced that they'll make 400 million N95 masks freely and widely available. So that's great. N95 masks can also be rotated and reworn until they're either visibly dirty or broken. And they can be more breathable and more comfortable than nearly any other mask you've tried. But even if you can't get access to something like an N95, make sure that your mask is designed to have a high quality filter in it and that it fits tightly to your face. Don't forget about the tightness of the fit, and it has no gaps. But no matter what, keep encouraging your staff and students to bring their mask A game for the time being, during this surge especially. Getting vaccinated or boosted, wearing a high quality mask provides great individual protection, but it's not critical just for you, as Dr. Raisman said. When everyone wears a mask properly, they keep virus from getting into the room, so the protection multiplies. That's why data-driven mask mandates are so important and successful when treated seriously. When surges like this Omicron wave are racing through the population, individual efforts are not enough. We've got to care enough for each other to respond collectively as well. Frankly, if we accomplished only those 2 well, we'd be in much better shape. But here are 2 other important layers. Third, add portable HEPA air purifiers to some commonly used areas, making sure they're correctly sized, and avoid ionization and other add-ons. An earlier CDC study showed that adding a HEPA filter reduced respiratory particles by 65%, and with masks in use by a total of 90%. Another study showed classroom risk dropped by 2.5 times using a single HEPA filter. and even more when other strategies were layered in. Okay, next slide, please. A great inexpensive air purifier option is to build Corsi Rosenthal boxes, as shown on the screen. You can make them creatively, as shown in various different examples on the left. These are essentially several furnace filters taped together with a box fan. Many, many thousands of these have already been made for US schools. They're easy to build, even as a class, and for less than $100, you can have a great air cleaner. I'm not going to minimize the fact that there is cost involved, but this is one of the strategies that can be employed. Fourth, be aware of shared air. Move activities outside when you can. Open windows, turn up the ventilation rate. Using a CO2 sensor can help you get a feel for how fresh the air is and when it's not. Focus air cleaners in the worst rooms or whenever occupancy is the highest. And be especially focused on times when masks come off, like in the lunchroom. Okay, next slide, please. A graphic analogy I like to share about lunch is that wearing masks most of the day in a classroom to reduce COVID spread, only to remove them when we sit closely together in a cafeteria, is a little bit like telling all the students to hold their bladders all morning when they swim so that they can all pee when they get in the hot tub together at lunch. COVID doesn't take a magical break for lunch, so we make sure your policies and meal rooms or banned classrooms are consistent with how COVID really spreads through the air. Go outside when masks are off if it's safe and whenever weather makes it possible. Pay special attention to cleaning out the air in those spaces inside using windows or added air cleaners. Stagger cohorts of students so ventilation has time to work. Consider distancing kids and even encouraging meals to be a little bit quieter so that the amount of aerosol that comes out is a little bit lower and spread is reduced a bit. For even longer term health gains, encourage your district to use funding to improve ventilation and indoor air quality. This has shown lots of benefits like reducing asthma, allergies, and improving test scores. When indoor air is fresher, people inside focus better and are healthier. So you may not be able to do all of these things that I just listed, but add all the layers that you can to reduce personal exposure and to help make the school environment as healthy as it can be. We know how to slow this COVID down. Let's do it so we can keep our kids healthy and our schools open together. Oh, thanks.
Okay, we have some actions already of things that we need to ask for. We want to make sure that we have quality masks in our schools for educators as well as students. Here in New York City, there are KN95s being provided to teachers, although there was just a recall, but we could talk about that later. But we don't have it for our students. So these are things that we must elevate. We see your questions, we're collecting your questions. So rest assured that we will address them. But we want to move on to the introductions from our panelists. And I want to introduce to you Dr. Robert Darnell. He comes to us from Rockefeller University. And what's been amazing about Dr. Darnell is that he was one of the first to develop a saliva test for testing for COVID, and he's been using them in different school settings. And so he's really going to focus on talking about testing in schools and how important testing is, and some of the things that he's been able to accomplish in the last 2 years. So Dr. Darnell, take it away.
Thank you, Clarice. And it is a pleasure to speak to all of the educators and the larger audience here. I am at an educational university and have been dealing both as a physician and a scientist with the pandemic since the very, very earliest days in January 2020. And my role there is a mixture of giving medical advice to people who are infected and doing testing for infection. So I'm going to talk about that in a broader perspective, starting off here by just underlining what the critical issue is in the pandemic, other than the illness caused by the virus itself. The reason it's a pandemic as opposed to, for example, SARS-CoV-1 or Ebola or other diseases that are caused by similar, in some cases, very similar viruses, is that this virus that causes COVID-19 allows us to get infected and transmit to others before any symptoms develop. So there's a silent period where transmission goes on. And that's critical to understanding why mitigation is so important here. So of course, vaccines are the top of the list right now for the proper way to mitigate your risk as an individual and a community. But until they cure everything, and I would asterisk this and mention that vaccines are inordinately powerful. Smallpox was eradicated by a good vaccine, polio nearly eradicated by a good vaccine. But this particular virus is tricky, as the other speakers have mentioned. So other mitigation strategies are critical now. And that includes ventilation, masking, as we just heard about, and also testing, which I'm going to talk about. So I would say our best testing strategy is serial asymptomatic testing. And I'm going to talk about 3 takeaway points for you to think about. One is that high quality testing is achievable here and now, and it's applicable all the way from pre-K through high school in the educational space. Number 2, testing is a critical mitigation strategy, and I'll talk a bit about that. Takeaway 3 is that testing not only protects each individual, but it protects all of those around us, the most vulnerable in particular. And that provides both a help to the community and a tangible comfort to everyone. So next slide. Thank you. Asymptomatic testing is something that I came to believe strongly in through our work at our university. We have a pre-K center there, and we developed a lab-developed test that is cheap and very easy to use. It's been used for 2-month-olds up through 92-year-olds. In particular, our focus initially from June of 2020 up to the present was initially and continues to be this pre-K center. So it's an interesting testing ground, if you will. The children are able, in the next slide, to do this testing themselves. And we've developed it in a way that obviates this problem, which is nobody likes to get a cotton swab stuck up their nose. In particular, children don't. So the next slide just is an illustration of what we've developed here. Is a very, very easy to use saliva-based test in which really only microliters, that's 1,000th of a milliliter. A milliliter is a teaspoon essentially, or 15 milliliters is a teaspoon. So only a tiny, tiny amount of saliva is needed, which is why it's able to be done in infants up through kids of all ages, as well as adults. So by developing this test that's easy to use, we've been able to keep our pre-K school open from June 2020 to the present, all the way through the current Omicron surge. And we're able to scale it relatively easily from a research but clinical laboratory to now having tested nearly 100,000 individuals with this test. And that's allowed us to keep the entire school open, allowing moms to go back to work and staff to stay safe, as well as the babies. So it also has immediate practical implications. It allows us to isolate individual cases, of course, and that has led to this sort of pod concept that's very useful in our school, where each classroom is kept essentially to themselves from the beginning to the end of the day. And if a positive test comes back, and we do our testing so that we get same-day results, it's a PCR quality, it is a PCR test, that classroom closes and kids don't come back until they're cleared. And so that pod concept has proven very useful. It also, again, creates this atmosphere of calm in the educational environment that reduces parental concern and teacher concern, and has given us a sort of glassnose to the community. So I want to move on the next slide to the concept of testing as a mitigation strategy. So the virus has taught us, and Omicron is emphasizing, that an individual can spread within the classroom to home and beyond. And this slide is meant to underscore what the consequences of infection are, which we obviously don't have full time to talk about, but this just points out how much we don't know. And as a physician in particular, my job as I see it is to protect both the individual and from a society point of view, make a balanced advocacy for both at the same time. So this slide points out that this is a fairly recent study, but it's pre-Omicron and it was not peer reviewed, but nonetheless points out from a large cohort of individuals comparing vaccinated in red and unvaccinated individuals in blue. On the left, the risk of having bad respiratory failure, respiratory illness, is tenfold reduced easily by getting vaccinated. So that's borne true even today through the Omicron situation. And on the right, however, this large cohort was also followed for long COVID features 6 months out. And there are essentially an equal probability of having long COVID in either vaccinated or unvaccinated individuals. So again, this is pre-Omicron. This may be mitigated over time by earlier detection, earlier treatment with oral pills or better vaccines. But it really is meant to underscore how much we don't know and the importance of caution, in particular in this conversation in mitigation, protecting for what we don't understand. So the next slide is the last critical point I want to make here, that testing protects not only each child in school and each teacher, but it has a ripple effect because each child goes home. We're seeing with Omicron now, infections are rampantly spreading through entire households. And we have cases where children were infected at our university situation and have gotten that infection from visiting a grandparent and then gone on to infect their whole family. And the opposite could easily be true. A family member can infect a child or vice versa, and that could go on to infect an elderly, vulnerable adult. And I would underscore that vulnerability sounds like an abstract concept for most of us, but it's actually not. Vulnerability includes a huge range of illnesses that people manage with in normal times fine, but make them vulnerable in the context of COVID-19. And that includes everybody essentially has had cancer at one point and battled it off. It includes individuals with autoimmune disease, it includes the elderly, it includes patients with diabetes, and the list goes on and on. So I think that's my last slide. And I want to simply say that it's a pleasure talking to you, and I believe that now is the time to push mitigation. I think we've heard recently from some physicians, my colleagues in some sense, but not in others, that guidelines have suggested in some cases that asymptomatic testing should be discontinued at this stage in the pandemic. For example, a recent policy guideline from Children's Hospital in Philadelphia. And I have to say, I could not disagree more. We need to scale up mitigation testing for all the reasons I've discussed, build the infrastructure as needed to deal with both the current situation and long-term challenges we may face. As discussed previously, operational details can be worked out now, but the challenges in front of us are not a reason to throw out the baby with the bathwater. So conclude, and I'm happy to talk later with questions.
Thank you so much, Dr. Darnell, for illuminating the importance of COVID-19 mitigation measures and the impact on children. So not only are masks, ventilation, vaccines important, but the testing is crucial. It protects the most vulnerable, including children and vulnerable members of their household. So we would love to come back to this further, and I know that there are several questions about this in the chat and also in our Q&A feature. So if you would like to use our Q&A feature to drop questions, that would be great. It's usually easier for the panelists and moderators to see your questions if you put them in the Q&A versus the chat, where it may get lost. So I would love to introduce our next poll. Tell us about thresholds for closure in your district. So we're going to go ahead and start this poll, and hopefully you should see it appear on your screen.
We're at about almost 60% of folks participating. The numbers are still coming in. Almost at 70%. And as soon as they slow down significantly, I will end the poll. Looks like it pretty much is slowing down. Okay, give it 10 more seconds and then I'll end the poll. Okay, 1 second, please.
So it seems like in terms of thresholds for closure in everyone's respective districts, they basically no longer exist according to the majority of the participants. Almost 70% feel that way. And then a smaller number feels like they do exist, but it requires too many cases. And then the trigger, and a very small minority of people said that the trigger for closure makes sense. So we're definitely, hopefully, going to dig in on that a little bit more and think about what is happening and what can be done. But we'd love to ask one more question. Can you tell us about COVID testing in your school then, so we could understand the picture a little bit better? Is it happening at all? It's happening more than enough or not nearly enough? You should be able to see your poll at this point.
We're at 70% right now. 79 folks out of 112 have responded so far. We're now at 80 people who have taken the poll, 81. As soon as they slow down, I will also give you a 10-second warning. They are still coming in. We're at 89 people right now. 90. All right, slowing down. So we'll give it 10 more seconds. Okay, I'm going to close it in 3, 2, 1. We are at 95 people who took the poll.
Thank you to everyone who participated in this poll question. In terms of testing, again, we have a large majority of participants, 73%, who said that there's not nearly enough testing in schools. And then a smaller percentage, 18%, that's saying it's not happening at all, which is definitely concerning. And then about 10% saying it's happening enough. So there's definitely a lot to think about there and discuss. And I think this is going to give us great context for the panelists to dig in and think about what we can do when we have a complete lack of testing in many of our schools. And I'm seeing a lot more questions in the Q&A feature. Please continue to add your questions either about the polls or anything the panelists have discussed so far. Please continue to add them to the Q&A versus the chat feature. So I have the pleasure now of introducing our last panelist, Dr. Deborah Verholden. Dr. Verholden comes to us from Michigan State University College of Human Medicine, where she's the Director of the Division of Public Health, Associate Dean for Public Health Integration, and the CSMA Endowed Professor of Public Health. She's also on the Michigan Coronavirus Task Force, focusing on racial disparities, and the Greater Flint Coronavirus Task Force, focusing on racial inequity, as well as the task force in New York City for African American, focusing on African Americans and COVID-19. If you're not following her on social media, her Twitter account, definitely do so. For a lot of amazing insights on what's happening now with COVID and specific racial inequities and disparities. Dr. Verholden, thank you for joining us.
Thank you. And I'm happy to sort of be the last speaker because I think my colleagues that came before me did just really an outstanding job of laying out some of the real key issues that we're dealing with. I'm an epidemiologist by training. Like many epidemiologists, most people didn't know what an epidemiologist was. Most people didn't know what an epidemic was, let alone a global epidemic or a pandemic. So myself, like many of my colleagues, we pivoted during COVID because it became an all hands on deck kind of phenomenon. So what I want to talk about, and I'm going to tie in a couple of things that some of the other speakers said, because like I said, I think everything that was said here, I agree with. And I want to give an amen to Dr. Darnell about that disagreement around not testing people who are asymptomatic. I know, and I fundamentally believe with a virus that has so many people who are asymptomatic or have symptoms that they don't recognize as COVID, if we only test people who have symptoms or a known exposure, we're never going to get a real handle on this. So next slide, please. There's this really great model called the Swiss cheese respiratory virus pandemic defense model. If you could hit the little play button. And you probably saw this. It was actually in the New York Times. It's a model that was developed by some of our colleagues in Australia. And basically what this model purports is that you can build a wall of protection and imagine those particles are the virus. So it's like Swiss cheese, right? There's holes and no one layer is perfect. But as you start to build up multiple layers, what you build is this wall of protection. So it's broken out in two sort of features. There's personal responsibilities, and we hear a lot about that. The physical distancing, the masking, and we all have better information now. Masks still work. They just need to be well fitted and they need to have multiple layers of filtration. You know, avoiding your hands, you know, in your face. You know, a lot of people miss that COVID comes into the body through the mouth, through the nose, and also through the eyes. So keeping your hands out of your face and things like that. But then there's this other world of shared responsibility, and I kind of want to focus a little bit more there. Things like access to fast and sensitive contact tracing and testing, indoor ventilation, some of the things we've already talked about. This idea around government financial support and regulations and messaging. And we know that the messaging, and that's the little misinformation mouse who came in there and started oh, I wasn't supposed to replay, who started nibbling on the, you know, on the layer there, because misinformation actually eats away at some of these really important layers of protection. All the misinformation about the vaccine and its safety and effectiveness, bad information that's gone around about therapeutics and things like that. And so the point that I'm trying to make is, if we can have all of these layers happening at the same time, we can build that wall of protection. The problem is we've rushed to get out of the pandemic, and as a result, only made it last longer. We got the vaccine, and before we could even get anywhere close to a substantial portion of the population vaccinated, states started lifting mask mandates. We stopped, you know, restrictions on indoor gatherings. People sort of said, yeah, oh, the pandemic's going to be over because we've got this vaccine now. The power is in having all of those things happening at the same time. Next slide, please. So I won't belabor the specifics, but I like to give people something that they can walk away with as you think about it. And I call it the 3 Ps for safe reopening. And the 3 things that we need, the first thing is a plan, right? And we've heard a lot of districts have a plan for reopening, but that plan is not comprehensive, and it doesn't include metrics and measures and indicators for when you have to pivot and go back to remote learning. The plans need to be based in science. They need to be building upon evidence-based strategies and promising practices. We've got a lot of places in the country and across the globe who figured out better strategies for safe reopening, but we don't mimic those things. And then the last thing with the plan is it's got to map onto what's happening in community. The CDC, I know, has sort of been all over the place, but one of the things that I do appreciate about what they've highlighted, at least if you look on their website, is they provide these recommendations, but it all has to be put in local context, right? So the plan has to include your local context. The needs in New York City might look a little bit different than the needs in Flint, Michigan, where I am. And those things need to be community informed. Clearly, we need the provisions. And when we talk about provisions, many of those need to be coming from government. It's unfortunate that we are the country that we are, and we've yet to have a national mask mandate in place. It's unfortunate that, you know, we don't have, you know, fair and equitable access to testing. The issue that we just faced in my own county is we couldn't send our kids back because we're waiting on test kits to come from the state. So we got to have those provisions in place. And then we also need patience. It's been very disheartening for me to watch our elected leaders, elected officials, so-called health leaders give people the false impression that the bad days are behind us. Oh, that we're out of this. Oh, that things have turned the corner. When in fact, that type of messaging has resulted in now this new surge that we have. So people really, we have to have patience with this. Remember, this, you know, family of viruses, coronavirus is not new to us. It's the same family as the common cold. But this particular coronavirus, SARS-CoV-2, the virus that causes the disease COVID-19, is new. It's not moving anyway like SARS-CoV-1 did, which just petered out in 2 years. I don't think any of us expected 2 years ago that we'd be where we are now, but here's where we are. And then somebody makes a great comment about depoliticizing public health. I consider it to be a battle where politics and public health got in a battle and politics bought public health right over the head. We hear oftentimes lead with the science, but much of what we do is not science-based. It's based on economy, it's based on big business, and it's based on politics and political will. So these are the sort of basics. And I think it sort of summarizes what the others have said. We need these comprehensive plans, we need provisions, and we need patience. The last P that I didn't put here, because this is like my jam, next slide, please, is we need laws and policies to anchor the things that we know do not work about our society, that do not work about the opportunities for education, for being in safe and supportive learning environments. Inequity was baked in to our society. Our country was founded on inequity. I say it's our natural drift. And by that, I mean, without intervention, we naturally spiral down the drain to inequity. So if equity actually matters, and this new administration says it matters, then where are the laws? Let's not forget, legislators are supposed to legislate and make laws. I don't need you out in the community with a photo op at a testing site. I need you in the state house writing laws, putting in a state mandate for masks for children in schools and the staff, and then putting the provisions attached to those laws so that they can actually be implemented. And even better, we need enforcement of those laws. Laws without enforcement are the same as gums without teeth. If we could get some federal mandates, it would stop the push and hoisting the burden of doing the work on our state and our local governments. And in my county where I live, in Genesee County, I'm in Flint right now, our health officer issued the first school-wide mask mandate for our county. She received a credible death threat. The woman who did it bought a firearm, got her address, made a plan to kill her. Can you imagine this woman, this well-trained public health physician who took up the mantle to come to Flint post-water crisis to lead the charge to protecting and preserving the health of our community, did nothing but put good public health into place, put a mask mandate in place in schools for kids, and then on her dime, provided those masks to the schools, and the price she had to pay was a credible death threat on her life. It's crazy. We need people operating at the highest levels. We need federal mandates, and then we need state mandates. And what that would do is inspire what I call communities of practice. Because if New York is anything like my county, we've got kids in one household who might be in different school districts. We have an intermediate school district and then community schools. So we've got like 20 some odd districts in this little place of 400,000 people. And it's very, as you can imagine, racially and economically segregated. So there's some wealthier, whiter districts, and many of those districts are very anti-mask. They're just very anti-mask. The things that they say about the mask and the experience for their children, I won't even repeat. And then we've got other places in our district where people are just 100% wholly committed to whatever will keep their kids safe and give them opportunities for learning in safe and supportive learning environments. But what happens is, if you don't have to wear a mask at this school and you do have to wear one here, kids are vectors. Those kids are bringing COVID back home. They're infecting people in their household. They're infecting their siblings who are then in a mass school, and they become the then person who's spreading in their school. If we had mandates and laws at the right levels, it would force the people who are doing it well to share with the people who are not doing it so well. It would force the people who are not doing it so well to reach out and lean on and glean from the people who are. So I say, if equity matters, it has to be mandated, it has to be enforced, and it has to be attached to resources. And what we say is, where there is goodwill, there is a legislative way. So if these leaders, these so-called leaders, these so-called elected officials say they care about equity, then they have to mandate it, they have to enforce it. The legislators legislate, they make the laws, the executives enforce, and then it has to be attached to resources. So that's the hashtag. I founded that hashtag about 8 months ago, mandate equity. And just thank you. Thank you for the opportunity to be here. And I'm looking forward to taking on some of these amazingly brilliant questions that I see in the Q&A and in the chat.
Oof, taking us to church today. We could not agree more. And we're seeing these differences from state to state. In some places, you know, the cases have started to decrease already. In others, I think today the projections were released, and in all of the United States, we're still seeing, if we take into account everybody, we still see an increase in COVID cases. We're not doing enough across the country to ensure safety in our schools and in our communities, because our schools are a reflection of our communities. And we have some amazing questions in the chat, and we're looking at the time. I think some of the things that Selena and I just wanted to touch base on is that there is movement, there is organizing. I do want to acknowledge that we've had some amazing students across the country organize and hold our elected officials, our school leaders accountable for not creating a safe environment for them. And they have chosen to take the lead in moving the pendulum and getting people to the table, getting themselves to the table to engage in these conversations. Today, I think it was in Wisconsin, we've seen it in New York, Boston, Oakland, like these kids are throwing down. And like always, they're teaching us how to do this work. As a neuroscientist, I will say, of course, it's always concerning when you see studies about a virus that can dramatically impact the fuel to the brain. When you see a virus that has also been showing that there's an increase in risk for diabetes in children that have had COVID, because all of these things can impact cognitive function, which in turn impacts the work that we need to do in our school communities. And although a child's brain is what we call plastic, which means we can implement different interventions and we can do different things in classrooms in order to enhance their learning, we never know what the long-term impact is going to be, as it also intersects with mental health issues and other physiological conditions that can impact the learning of our children. All that being said, we do have the tools to mitigate the spread. We're talking to you about all the things that we can do right now and how we can hold our legislators accountable, how we can call out the ineffective and inadequate leadership that we are dealing with right now. Like Dr. Holden said, all of a sudden we were just like, hey, it's okay, let's not mask, let's not test, and let's not provide a remote option because we can have kids in school buildings. I want to bring up Selena really quick, because she was just recently in the classroom and knows a lot more about the experiences of our teachers and how they've been managing in the pandemic. And we're going to start answering some questions with our panelists.
Thank you. I really just have so much on my mind right now based on what our panelists have said. Just so much of this resonates, and I've been reading everything that everyone has been putting in the chat and the Q&A, and I know that after teaching during the pandemic, teaching remotely, being in the building, and all of just the back and forth in New York City with constant just changes, it seems like every day there's something new happening in terms of what's being mandated, what's not, what schools are doing, what the city is doing, what's safe, what's not safe. But I know that teachers themselves know what's happening. And I think that everybody, for the most part, feels like I felt, which is that the schools aren't doing enough. Our government officials are not doing enough, and that a lot more can be done, and a lot of medical expert advice is being ignored, and risk is being minimized, and a lot of harm is being done, not just, I think, health-wise, but I think students are really being harmed as well, just emotionally in a lot of ways, just by the disruption, and then being put in schools where they feel unsafe to the point of feeling like they have to demonstrate in something like a walkout. I think the students are really saying what's on a lot of our minds is that this really just is not good enough, and that this country can do a lot better for our students, for our children, for our teachers, and for all of us. It's just really is just so subpar and beyond, I think, what we really deserve. So I'd like to open up with a question on just this idea of public health and what is an individual responsibility, and really this emphasis on the individual as almost like this, a public health policy. But I think a lot of people are in disagreement with that. Can panelists, I would love to hear a few of you talk about the idea of collective responsibility, and where you'd like to see policymakers land on this front.
I will say
I'm
something.
happy to jump in. Oh, Deborah, go ahead.
Well, I think we've overemphasized personal responsibility and not put enough emphasis on shared responsibility and the role of government and our pandemic response. Early in the pandemic, everybody got this, sort of mandate to shelter in place. But if you were an Uber driver when the pandemic started, how are you going to keep the lights on and keep food on the table? We created these quick fixes, right? We had a moratorium on evictions. But what we didn't take into account was eventually those moratoriums would be lifted and all of that money would come due. We didn't take into account that your typical person who is a landlord actually is just renting out their first home, and they went and bought a second home and their mortgage was still due. We created quick fixes. See, I think of it like this. I say COVID is the snitch. COVID told on many of the gaps in our system and how we unfairly and unequitably treat people and how we don't provide for all people equally. And so I think we need to remember this, because we do have some power. We have power in our vote. I don't understand how some of these governors could be reelected, how the people who would reelect them would not hold them to task for the tens of thousands of people that died in their state because they refused to put a statewide mask mandate in place. So I do think we've had a severe overemphasis and hoisted a lot of the responsibility on individuals and on the little guy, and not focused enough on the larger governmental responsibility in this pandemic response.
We agree with everything Dr. Holden said now and in her fantastic talk. No individual can clear the air of COVID on their own. That is only something that we can do through coming together to protect one another and to reduce the spread to one another with mask policies and with vaccine coverage. We see that when we underserve our lowest income communities again and again, when we under-vaccinate, when we don't provide masks and tests in an affordable and accessible manner, when we send everyone back to places with high exposure at work and in schools that are not adequately protected, it ultimately underserves all of us. It is the virus and it is the inadequate protections that close schools, that close businesses, that kill people, that leave children without their parents, that leave teachers and staff at risk of severe illness and death while hospitals are overflowing, and that leave healthcare workers bearing witness to all of it. It is leadership that we need. Dr. Holden is exactly correct that we need it from the top. We need leadership from the federal government to help us come together and to protect each other. And most of us want to do that. And we need our federal leaders to lead now more than ever. Disasters exacerbate disparities, and this is a joint economic and health disaster. And we've made it much worse than it needs to be. And we should start making it better now, because it's likely to be with us for a while.
I can just say real briefly that Dr. Raisman and Dr. Holden said it more eloquently than I will, just to say there's no question that we have individual responsibility and collective responsibility. From an aerosol and airborne science perspective, these layers that we put into place are not exclusive to one another. The masks do a great job of preventing things from going into the air, but we need to get everybody wearing them. It's not just about the individual wearing it. We have to do things that help us all to protect one another. And ventilation and things like this are not something that an individual just walks into the classroom and says, I'm going to upgrade ventilation. There has to be some kind of a collective motivation to do this. And so it's an easy way to for governments or whoever's in charge to put off the responsibility onto the individual and say, well, you can just do whatever you need. But there's no way it's going to work that way with only individual responses. That's why we're in the place where we are.
Dr. Darnell.
Yes, thank you. I got unmuted. I'm delighted. So I agree with everything Dr. Verholden, Raisman, and Huffman had just said. And I would raise it a couple of notches. One is, I think there needs to be an active collective action on our part to push back on the government, because as we saw in the context of Rochelle Walensky's announcement about decreasing mitigation and getting people back to normal, there was a overt, not insidious component of the airline industry having a vested interest in pushing that message. And Dr. Walensky was not shy about making that clear. And of course, that turned out to be a disastrous policy, costing morbidity and death in this country. And the second level I'd like to sort of raise the bar on is that everything I keep reading about in the news is about the United States, the United States, and the United States, which of course we live in and we care about, particularly the disparities and inequities that are overlooked all the time. But at the same time, there's an outbreak going on in Ethiopia that's a disaster. Africa is underlooked as always. South Asia has had incredible struggles. Much of the world needs leadership. So the leadership we need to push forward is not just the leadership for the United States, but this crisis won't go away if the United States builds a wall around it. COVID will break through that wall. We know that happened and that will continue to happen. So we need to mitigate ourselves and our children, and we need to export that to the rest of the world in a thoughtful way. We need leadership in every sense of the word. Now you can mute me.
Thank you so much, Dr. Darnell, and the rest of our panelists. That I think really resonated with everyone here today. And we definitely have a lot of questions from our audience. We really want to get a chance to jump into it before we wrap up tonight. Based on everything that was said and based on our audience questions, there's definitely a lot of questions about what should teachers do or even parents do when they're in schools or their children are in schools that lack any mitigation efforts, and they feel like the government, the local government, is not helping in terms of policies and mandates. There's no masking, there's no social distancing anymore, they need ventilation upgrades, etc. What should adults do in those situations, teachers and parents, to help their children and students?
I will say the first thing they should do is get their children vaccinated. That is the foundation for prevention of infectious disease. They should get their children vaccinated. And then it's really funny. I remember when my little fella, went to school, I sent him with a Spider-Man lunchbox and he came home with a Superman lunchbox. And I'm like, what happened? Right? Like, this is the time to really start to have these conversations with your kids, right? Like, you need your mask and they need to understand. I've learned so much myself in this pandemic, and it's been really cool to see how much kids now know. I'm not a fan of hoisting the responsibility on the individuals. I feel like we really got to focus on the context, but there are real tools that people have in their hands that can protect them. Masks are effective, especially when everybody is wearing them. The vaccine is really good at preventing severe illness. There's good data that's showing it's also protective in helping people who have long COVID. We're still trying to understand even some of those causal links. So I say the things that are in their hands, they need to take the reins with those. This is a great opportunity to build that sort of knowledge base with your kid around, this is why we're getting the vaccine. This is why I want you to wear your mask. This is why it's important for you to be mindful and wash your hands. This is how you wash your hands. My mother never told me how to wash my hands. I literally feel like I just relearned during COVID how to wash my hands. And lo and behold, when I did the tutorial, what I figured out, I don't do a good job with the thumbs and the backside. I'm one of these kind of hand washers, real fast. You know, so there's a lot I think that parents have in their hands that they can give their kids. And the most important thing they can do is take them to get vaccinated.
Yeah, I absolutely agree with that. Vaccination and wearing a good mask. Honestly, from a personal perspective, the question as posed is not too different from the situation that my kids are in right now. I don't feel like our district has really done a whole lot with mitigation for all sorts of reasons. And I wouldn't say I feel comfortable sending my kids in that environment, but I do send my kids. And we made sure that all three of them have really good quality tight-fitting masks. So they're vaccinated and the tight-fitting masks. So just put a little bit of effort into that side of things, especially if you have the agency and the resources to think through that. My two youngest actually wear what's called an elastomeric respirator. It's for something like 30 or 40 bucks. So it's quite a bit more, but it's reusable and it fits really nicely and it's more comfortable. But there are some other things you can do as well. And it just depends on your own situation and the privilege that flows through your life and not. But we decided to move my daughter, who's in middle school, out of the lunchroom for lunch. And she eats in a classroom with just a few people because that's a particular risk area. And so we tried to figure out how to solve that piece of the puzzle. And I just went from the top to the bottom of the priority list in terms of risk. So getting her out of the class, out of the lunchroom was important. And we had a hard conversation. And though she loves trumpet, we decided we needed to take her out of trumpet for the time being and move her. She now plays the cello. So there are things that we can do to reduce that aerosol risk there. So we can't take everything out, but masks, vaccination, and then try to take out some of those high risk areas as well.
Yeah, I think my main response is I'm just really sorry that you're in this circumstance and that your community is in this circumstance, that your family is in this circumstance. And, you know, again, I think our federal leaders, they are in charge of setting the speed limit here and setting the bar. There's not much of a bar in sight. So I think we really need better, stronger federal leadership, communication about the fact that COVID is a very real and continuing problem, not minimizing it just because someone is vaccinated. We see this is a societal challenge and this is societal upheaval that we've all experienced with Omicron and we could experience again with further surges. We're actually likely to experience again in some sense with further surges. And we really need leaders to do a better job of leading with the facts that COVID is a problem, it's continuing, and we need to manage it and making that case. And we do see that most people support the policy. So they really, you know, where there's a will, there's a way, like that we're here for it and we need our leaders to lead on it and to really focus on equity. So, you know, I think we also need people in the room making the decisions who are from the communities most affected, who are from schools who face, you know, people face very high exposure, who are other essential workers and who are Black, Native American, and Hispanic, and who have much higher excess deaths and exposure to COVID. So, I think these are some of the things we can do, but we've also seen that when our leaders are not leading as well as they should, each of us can make a difference in our community with the people around us. So let your friends know about how important it is to get vaccinated and boosted as quickly as possible and to get their kids vaccinated and boosted as quickly as possible. Let people know about masks. You can educate your students about masks and about the differences between masking alone versus masking together. You can empower your students with knowledge and with information on the actions that can protect them and can protect their community. And each of us has a role to play in leading our country in a better direction.
Thank you. I just want to ask Dr. Darnell one of the last questions, because we do have to close, which is a lot of folks are really interested in not just the saliva testing, but everybody's getting these rapid antigen tests, and all school districts are providing different guidance on when to take the test, how to take the test, how long, when you can come back and when you can't. So can we get some feedback from you? What do you think? What should we be doing in terms of testing, and when would be the appropriate time to use the rapid antigen home tests?
Yeah, I think the plus side of rapid antigen tests is that they're here or will be soon and are relatively available. So I can't argue with that aspect of their success. I think it's worth people knowing that a negative result on a rapid antigen test is of relatively limited value, because it has a high false negative rate, meaning it misses positives, not infrequently. On the other hand, a positive rapid antigen test is truly valuable for the most part, because it means someone is likely infected. That person can then be taken out of school, quarantined, and that's of value to everyone. So I think, right now, I would say, if possible, I would advocate getting rapid antigen tests as much as possible. Twice a week would be great. More often would be better. Every day would be just fine. And even still, it's not perfect. It really is up back to the discussion about the federal government, is like, where are they? Why haven't we scaled high quality PCR testing, which is of much greater value to each individual and to society? So I think that should continue to be pushed forward. But in the meantime, rapid antigen tests are widely available, so I would use them as much as you could. Is that satisfying?
Can I add one quick thing to that?
Yes, please.
Because I can't tell you how many times I've been out and somebody will cough and be like, oh, I don't have COVID. Or they'll have the sniffles. Oh, but I don't have COVID. I don't want your cold either. I don't want your flu. I don't want your any of that. So yes, Dr. Darnell, serial asymptomatic screening, I love it. And if your antigen test is negative, take another one the next day. And if you have symptoms, you should be home anyway, because you shouldn't be out spreading your germs, whether you're an adult or a child. If your child is sick and has a cough and a runny nose, even if they don't have COVID, you shouldn't send them to school. That's the other thing. We have so many different things happening at the same time. In my community, we've got the Delta Omicron battle. So we've got this wildfire variant spreading where just everybody's getting sick, but then we still have the variant that causes much more severe illness happening at the same time, mixed in with flu and RSV and all of these other things. So if you are sick, please stay home. If your child is sick, please keep your child at home too.
Great.
Amazing. I'm sure we can spend all night talking, but we do want to talk about some action. So we want to bring up our NEU host partners in the work, so we can talk about how we're going to continue to move this work forward nationally. We wanted to bring everybody together so we could have this conversation. We can have science-driven policies in our schools that would protect our communities.
Thank you. Good evening, everybody. Melissa Tomlinson, she, her, hers from New Jersey. I'm going to tell you about a couple actions that we have lined up already, and then a future action that we are hoping to announce soon. So the first one, we have been sharing the link already, and I believe somebody's going to share it again, is an Action Network direct letter. So now the targets of this letter go to the president, the vice president, CDC, the Secretary of Education, as well as the Civil Rights Office in the Department of Education. And in this letter, we are calling for most of what we discussed this evening with the improved layered mitigation strategies, mandated metrics with definitive measures of community and school transmissions levels that would allow schools to operate safely and trigger remote learning, reliable weekly COVID testing, the MERV 13 or greater filtration with HEPA air purifiers, free N95, KN95s, or KN94 masks for all education students, reduced class sizes, nurses and mental health professionals, which is something we did not even get into tonight, vaccine mandates and indoor masking policies, along with some demands for our communities in general. OSHA standards, paid leave, eviction freezes, universal basic income, stimulus checks, universal access to healthcare, and telework online work options. So we're hoping you'll take a moment to share that and sign it yourself. We really need us federal level. It's not going to be until we protect all of our communities that we're going to be able to beat back this pandemic. As we've learned, if we into place, the virus will still spread and it's going to continue mutating. And then our next axis is, our next action, if we'll go to the next slide, is a way to make sure that educators are having their voices heard in this battle. We hear a lot of what's going on in the healthcare field, in also essential worker, different job categories, about the conditions that they are seeing at work. But too often educators are afraid to speak up, in part because they are fearful of retribution. Let's face it, education is not sometimes the safest profession for us to be in, but we're joined with National COSH, which is the Council for Occupational Safety and Health, in the Worked Up campaign. And the link that you'll be getting in the chat has a Google form where you can share your story, just a comment, a greater story. You can upload a file, upload a picture. We'll be putting videos up, and you can do this with your name and picture attached, or you can do it anonymously. Either way, we just want people to know what is going on in our school buildings as we continue to deal with the COVID-19 pandemic. And then the last announcement that we are hoping we'll be able to get into place at the beginning of next week. We know that we've been emailing. We know that we've been speaking out, speaking in public forums like this, fighting against the pandemic and the conditions we're in for the past almost 3 years now. But we need to do more. We need to start calling directly. So we're going to be putting together a phone bank, and we're going to be spending a lot of time making direct phone calls and making sure that these decision makers know that we need our demands in place to be able to make ourselves, our students, and our communities safe. Rebecca says she's ready to phone bank. Rebecca's always ready to phone bank. And with that, our final information there, we have the contact information for joining us on this forum tonight. The information was amazing. Some of it was new, some of it was familiar to those of us that have been working in this national spotlight fighting for our safe schools. There are more resources that you can find at National Educators United website, including some of the state groups. We did see a lot of questions about how to advocate, how do we organize? That is part of what NEU does. We do it at a national level, like with the Action News, Action Network newsletter. We also do it at state levels. We have several state groups such as Arizona Educators United, NJ21 United, California Educators United. So if you reach out to us, we can put you in contact with any of the grassroots organizers that we are currently involved with. And I want to thank you everybody for joining us this evening, and a special thank you to all of our panel members.
Thank you for hosting us. We appreciate it.
Thank you for having us.